Which of the following is not an ideal suited condition for use of ring pessary in case of uterine prolapse? Late pregnancy. Labor is called normal if it fulfills following criteria except vaginal breech delivery. Which one of the following methods is not used for cervical cancer screening? Cervical biopsy. Consider the following regarding the use of magnesium sulfate. Used as tocolytic, used as neuroprotective agent, used in management of postpartum eclampsia. Which one of the following is not a common cause of recurrent abortion? Torch group of infections. Contraindication to uterine circlage for incompetent OS are all except previous history suggestive of abortion due to incompetent OS. The most common cause of early spontaneous abortion is chromosomal abnormality. Cause of fetal growth restriction may be chromosomal abnormality, congenital abnormality, abnormal cord insertion. Which one of the following regarding fetal growth restriction is not true? Delivery always at 34 weeks. Which one of the following statements regarding contraception is not true? Vaginal ring is a barrier method. A 26-year-old P2L2 has just had delivery. What are the contraceptive choice she has at present? Post-placental insertion of ICD, postpartum ligation. A 22-year-old woman comes with complaints of pain and discomfort in vaginal region. On examination, there is unilateral tender swelling in the posterior half of labium minus. Overlining skin is red and edematous. What is the most probable diagnosis? Bartholin's abscess. A 29-year-old woman is noted to have 3 consecutive first trimester spontaneous abortion. Examination reveals fibroid uterus. Which of the following types of uterine fibroids would most likely lead to recurrent abortion? Submucosal. A 25-year-old infertile woman is noted to have blocked fallopian tube on hysterosalpingography. Which of the following is the best next step for this woman? Laparoscopy. Which one of the following drugs do not interfere with efficacy of oral contraceptive pills and increase the failure rates? Ranitidine. Which of the following antihypertensive drugs is not safe during pregnancy? ACE inhibitors. Tubectomy is commonly performed at which site of fallopian tube? Isthmus. A 60-year-old woman presents with postmenopausal bleeding. On endometrial curettage, she is diagnosed as endometrial carcinoma. Which of the following is a risk factor for endometrial cancer? Diabetes mellitus. A 29-year-old woman presents in emergency ward with amenorrhea of 6 weeks and pain. Urinary pregnancy test shows positive. Examination shows diffuse, significant lower abdominal tenderness. The pelvic examination is difficult to accomplish due to grading. Her beta HCG level is 4000 milli-international unit per milliliter. Transvaginal ultrasound shows no pregnancy in the uterus and no adnexal mass but moderate fluid in abdomen. Which of the following is the next best step? Emergency laparotomy. Global Hunger Index combines 3 equally weighted indicators except child morbidity. Physical quality of life consolidates which of the following indicators? Infant mortality rate, literacy, life expectancy at age 1. The sequence of events leading to disability and handicap is disease, impairment, disability, handicap. Which one of the following is not done as screening test in pregnancy? Serum cholesterol. Which of the following statements is not true for taking a decision on screening for disease? Proportion of false negative is high. In a case control study, 300 women aged 20-45 years suffering from breast cancer were compared with age-matched 300 women without breast cancer. It was observed that 120 women among cases and 60 women among controls were obese. The odds ratio of developing breast cancer among obese women is 8/3. Standardized mortality ratio is best explained by which of the following statements? Percentage of total number of deaths that occur in a population to number of deaths that are expected to occur. In a family of 6, 2 parents and 4 children, the youngest child catches measles infection. The parents are immune to the infection. On 3rd and 5th day of the infection, the first child, the 2 other children also suffer from measles. The secondary attack rate, SAR, of measles is 66.6%. What is the relative risk of developing pulmonary embolism in users of oral contraceptives as per the information given below? Answer is 4.80. Which of the following epidemiologic methods can be used to identify risk factors and estimate the degree of risk? Case control and cohort studies.